And the governor's office says it has asked retired healthcare workers to come back to the front lines and called on hundreds more who can step up, nursing students.
We're just getting out all across the state. Students are able to help out where they can.
Nicholas Sanchez helping lead the way for fellow UNLV nursing students to aid in a crisis. The governor's office asking nursing schools across Nevada to send students to the front lines now.
But it's also going to increase patient care. Do you want to volunteer in the hospitals?
Nicholas is president of the UNLV Student Nurses Association, helping get the word out. The governor's office says 900 students in Nevada are eligible to become a nursing apprentice. A third of them are at UNLV. Older undergrad students are already trained to help patients in bathing, feeding. The shortage so severe, some nursing students in the north are working double shifts.
The hospitals are so overwhelmed that just people to do all kinds of things are helpful. Anybody who can work is being asked to work a lot. We do need to think now about how we can increase the pipeline.
The dean of the UNLV School of Nursing says Nevada leaders must look ahead now, how to get hospitals out of this crisis. She says UNLV has no problem getting or graduating students. The challenge is keeping nurses in Nevada. For example, in neighboring California, the pay is higher and laws limit how many patients a nurse takes on in a shift. That's not the case in Nevada. Or those willing to be flexible and take on temporary assignments as a travel nurse get paid significantly more.
Got a traveler who's making $250 an hour, and they're working alongside you, doing the same job. And until we look at our systems and how our systems sort of sometimes chew people up and spit them out, then we'll continue to have this problem.
Are you worried that the students that go to the front lines now, they're going to get burned out?
Well, I think that's a real possibility.
I think if I go into with a positive mind state and being aware of the full picture, I'm less likely to burn out.
So when could all these local students be helping inside hospitals? I'm told the process could take at least 3 weeks, but the hospital hiring and red tape could take as long as 2 months.